So my name is Amy Riley. I will be working at Conway Medical Center in the Women's Center and Midwifery. I knew I was going to be a nurse when I was a freshman in high school, and so I just didn't know what area of nursing I was going into. And when I was in my junior year back in 1996, actually, the fall of 96, I saw my first delivery, and it was like the lights came down from heaven. I was like, oh! And I knew right then, like, this was what I was meant to do. I took a very circular and long, what I thought was a very long 13-year kind of winding road to get to labor and delivery. So I've worked in surgical oncology, so I've worked with cancer patients, with solid tumor patients, I've worked with hospice patients, I've worked in the cath lab, ICU, so I've done, and I've taught, and teaching is a passion of mine as well, whether it's students or patients and families. And so when I finally got to labor and delivery, I realized why I had such a winding road to get there, because it laid that foundation, and it makes me a better clinician for having all of those years of experience in different areas. And when I finally became a midwife, it was just a dream come true, truly. I love catching babies. I love helping mamas and families through their pregnancies, whether it's trying to get pregnant or throughout their pregnancies, sitting with a mama while she's laboring, and a baby that might be sunny side up, kind of shaking her and doing different positions to get that baby to rotate to come on out. And it is a miracle every single time. My husband says, "Doesn't it get old?" I'm like, no. And the minute it gets old will be the time that I need to retire. I absolutely love what I do. I love my patients. Like I said, I love teaching. So I really try to meet patients where they are. So really asking them like what they know and what questions that they have. I always sit down when I see my patients. I walk in, I say hello, and then I sit down so that I'm lower than them. So that way they feel a little bit more comfortable, that I'm not towering over them in a position of power, because I want them to feel comfortable, because this is such an intimate time, whether you're doing a GYN exam or you're checking on a baby, listening to heart tones, or doing an ultrasound. It's a very intimate time with your patient and the family. And so I just want her to feel comfortable and be able to ask me any questions that she has. I tell them it's a judgment-free zone when they can tell they're being a little bit awkward. I'm like, listen, I'm the person you need to talk to about this, and it doesn't leave this room. So, just tell me what's going on so I can help you. And I love it. I absolutely love what I do. I can't imagine doing anything else. I've enjoyed what I did in the past, but my journey is where I'm supposed to be now.